The story of how one girl from Battlefield suffered a severe reaction to a commonly used antibiotic. Good evening once again to you. I'm David Oliver.
And I'm Jennifer Abreu. Thanks for being with us tonight. That girl we told you about eventually died after having a bad reaction from Bactrim. And she is not alone. Yeah,
tonight we go deeper, in fact, into a national study Abigail is now a part of. Keller 10's Melanie Chapman tells us tonight what led the doctor in this study to find out why this is happening and what can be done to prevent it.
Dr. Jeanette Miller is an ICU pediatrician at Children's Mercy, Kansas City. She got to know BJ and Amy Caldwell of Battlefield last year. The Caldwells reached out to her after tragedy touched their lives. Their daughter, 10-year-old Abigail, died 37 days after being prescribed the commonly used antibiotic, Bactrim, for a scalp infection.
For the first 7 or 8 months after Abigail died, we had no cause of death, nothing. Everything again was negative. Even her post-mortem exams all came back with no cause.
Abigail had a low-grade fever 18 days after starting Bactrim. She was taken off Bactrim on day 21, but her health continued to decline quickly. She was flown to St. Louis, and a team of doctors ran tests after tests, and still no answers. She was placed on an ECMO machine, the highest level of life support. On May 25th, 2018, her life ended.
So these patients present about 10 to 21 days after initiation of Bactrim.
Dr. Miller is leading a national study on Bactrim and its connection to healthy patients who developed acute respiratory failure after taking the prescription.
And by that I mean that their oxygen levels were very low and they had quite a large amount of difficulty breathing. And so they were all admitted to the hospital quickly after those symptoms were identified. And in the paper, 4 of 5 of them required lung bypass machines.
After Abigail's death, her grieving father started researching the ECMO machine. That's when he found this CNN story about a young girl who lived 189 days on the machine and even walked with it. He read her story and saw she had also taken Bactrim. The girl's ICU pediatrician was Dr. Miller, who said her symptoms may have been part of a severe acute reaction to Bactrim.
That's kind of how all this got going. Everybody was really interested that we had the autopsy done, and they wanted as much information as we could to send into that study because she was thinking that Bactrim had something to do with it.
27 people in the nation have also made contact with Dr. Miller. 8 are part of her study. Abigail is the 7th. The first 5 have been published. Dr. Miller says there are 3 components to her study: finding more patients and collecting all medical records, trying to find a more objective pathology link, and a genetic link.
That would be the way to identify patients in the future who shouldn't take the drug, because it does work for so many people. The goal is really to find a way to identify this small group of people who have this severe.
Dr. Miller says this is an international problem.
First, we are trying to reach all of the national providers, and so every person who works in a dermatology office, every person in an urgent care, in an emergency room, in pediatrics and adults, because we're seeing it across the spectrum of age, just needs to be aware that this is possible. And so if someone shows up and is on Bactrim and has these very non-specific symptoms at first, it could be something that's very severe and that we need to stop the drug immediately and hope that the patient can recover.
Amy, a cardiac nurse, said she kept asking pediatric nurses and doctors if Bactrim had something to do with Abigail's condition. She said she was told they had never heard of that. That's why she's sharing her story.
I don't blame anyone for Abigail's death. I don't. Everyone worked with the knowledge base that they had. But there's more knowledge out there now. And so I want the next time that someone calls that doctor's office and asks, that now it's recognized that maybe this is the Bactrim thing.
Dr. Miller says this is an effort to connect the patients from the past to help the patients in the future. Melanie Chapman, Ozarks First.
Now, when we first brought you this story last night, there were 25 patients nationwide who had contacted Dr. Miller with similar stories. And today, she said there are now 2 more, and she expects to hear about more cases.